Thank you, Deputies across the House, for your contributions to this debate. As the Minister of State has noted, an additional €15 million in core funding since 2019 and 2020 and a further additional €17 million in one-off funding is supporting the ongoing work to reduce waiting lists and to address access to services through policy implementation. I can assure you that the Minister for Health and his department appreciate the difficulties experienced by people seeking to access oral health care and that we will continue our ongoing work to address this. We are easing current access issues through a range of interim measures, and these include a 40 to 60% increase in payment for treatments under the Dental Treatment Services Scheme, and also substantial investment in orthodontics waiting lists initiatives. Ultimately, implementation of the National Oral Health Policy will achieve the substantive service reforms that are required to ensure that patients can access the care that they require, as set out in international best evidence and practice. In turn, we recognise that the oral healthcare sector must be enabled and supported to provide this evidence-based care through an appropriate framework of professional regulation, education and training and strategic workforce planning, as well as modernised contractual arrangements. The National Oral Health Policy, Smile agus Sláinte, sets out the vision for the future of oral health care services in Ireland. This is a body of very wide-ranging and transformative reforms, and the implementation plan for the 2024 to 2026 phase is in development to set out the key milestones and outcomes. The lengthy phase of policy development between 2014 and 2019 was fully cognisant of two policies in particular, which have provided the framework for the vision of transformative change which Smile agus Sláinte sets out. Smile agus Sláinte is based on technical concepts which the World Health Organization have endorsed for several decades, which embed oral health care in a primary care rather than an acute setting, and which emphasise the integration of oral health into general health through the recognition of common disease risk factors such as diet, alcohol consumption and tobacco usage, and which endorse the use of comprehensive oral health care packages which are prevention focused. Accordingly, Smile agus Sláinte reflects the ethos, practices and intentions of the WHO's Global Oral Health Resolution, Strategy and Action Plan. Smile agus Sláinte also applies the Sláinte Care vision of enabling patients to access the right care in the right place at the right time to oral health care based on best international evidence and practice in oral health care. And this means that the care the state is enabling the sector to provide will emphasise prevention and will aim to keep patients out of an acute setting as much as possible. The design and development of oral health care packages for adults and children that's underway within the HSE represents a significant expansion of preventive care. Care in the right place, as it applies to oral health care, means that people of all ages should be able to access care at local dental practices of their choosing, thereby establishing a dental home for continuity of care and allowing dental practices to build enduring relationships with their patients. The public dental service will continue to play a core role in oral health care provision. The changes envisaged will increase the capacity of the HSE service to reorient to develop oral health promotion programmes. There will also be greater capacity to provide care to those more vulnerable groups in the community, including adults and children with additional needs and adults living in residential settings. The Sláinte Care approach also means that people should have sufficient access to care from birth and across the full life course to prevent problems before they arise. And this is why, starting with our 0 to 2-year-olds who can currently only access emergency care, is a priority. This is a considerable change. It's based on the evidence identified. The government will work with the sector to support these developments, but the sector must also recognise the shift towards primary care-based preventive model across the life course. A key enabler of this transition towards the Sláinte Care ethos is ensuring that we have a sufficient number of appropriately trained oral health care professionals. In particular, we need to leverage and maximise the contribution of our hygienists, our dental nurses and other auxiliaries to provide the modernised prevention-focused care that we're developing to the maximum extent possible. And this requires change to our educational and legislative framework, which is comprehended in the policy implementation plan in development. We need to consider educational models which enable students to experience providing care in a community setting within our most vulnerable communities. We currently have more dentists on the Dental Council's register than ever before. We have 3,661 as of the 20th of May, but many more are needed. There's also a need to increase the number of dental nurses and other auxiliary grades. The Department of Health is committed to the development of an oral healthcare workforce plan as set out in the National Oral Health Policy. Dedicated resources have been set aside to advance this work. This workforce plan will consider how other dental professionals, such as an expanded role for the dental hygienists, can best support the new model of oral healthcare services, and how they in turn can be supported with career pathways that support staff retention. To support this work, the Department is finalising the design of the first oral healthcare workforce census skills assessment. The workforce census will gather information including the proportion of registered oral healthcare professionals who are practising in their registered profession, the services that they provide and the skills that they have. The census data will provide information to support the development of the sector and to support workforce planning by identifying the skills that oral healthcare professionals need to provide the new model of service set out in the policy. In addition to this, the Department is also examining a mid-level professional grade for oral healthcare. Reviewing the dental teams, including the auxiliary dental workers' scope of practice, will create more capacity in our workforce by enabling direct access to the public where appropriate. Such an approach will ensure that the profession is working to the top of their licence, enhance the potential of these roles, expand our workforce capacity and our ability to meet the population's primary care dental needs, aligned with Sláinte workforce reforms. Introducing a mid-level professional grade is a key priority for the policy. The Department of Health is collaborating with the Department of Further and Higher Education, Research, Innovation and Science and the Higher Education Authority, which is currently working through a process to identify opportunities to build capacity in the higher education system for dentistry and to support more oral healthcare graduates. The process was designed to respond swiftly to national skills needs, and EQIs were sought from expressions of interest were sought from institutions with capability to expand existing courses or to create new courses. This expansion is now being considered by the Department, by DeFerris, and in the context of the budgetary process. Potential new innovative models of dental education are also being considered with a focus on primary care. So I'd like to assure deputies that the Minister for Health will continue the ongoing work to address both the access issues that are affecting current healthcare services, but also to progress work on implementation of the National Oral Health Policy, which sets out a body of transformational reforms. Along with the Minister of State, I want to thank deputies across the House once again for their contributions, and I reiterate the Government's commitment to improving our healthcare services.
Thank you, Minister.